Get a professional in here to comment on this. Joining us to discuss all this, he's a cardiologist, internist, and the author of the book, The Courage to Face COVID-19. Our pal, Dr. Peter McCullough, back on the program. Let's see, should we start with COVID's just a cold, or should we start with, for 3 years, you demonized people. For 3 years, and when I say you, I mean the CDC, the FDA, the Biden regime, all those stupid celebrities, and every one of the mainstream media pundits and mouthpieces. We're all telling us that if we took ivermectin, it was going to hurt us. Like they said with hydroxychloroquine. Well, doc, you know my story. I took the concoction of a steroid, zinc, hydroxy, and ivermectin twice, because I had it twice over the last 3 years, and I got better instantly, and it worked. And here I am. I'm healthy as a horse. Idiots. Your comments on that. Sorry, I had to throw that in.
Dan, this is a shameful development for the FDA. This is Commissioner Robert Califf, HHS Secretary Xavier Becerra. They intentionally deceived America on ivermectin, but additionally also on hydroxychloroquine, and really all the things we did in the McCullough protocol to treat patients and help patients avoid hospitalization and death. Ivermectin is safer than Tylenol, has over 100 supportive studies, both inpatient and outpatient. And it's a complete crime that Americans were denied ivermectin. You know, patients should have received it not only in outpatient treatment protocols, but they should have gotten it in the ER all the way through the hospitalization as done in the ICON study that was published in Chest in 2020. Countless numbers of lives were lost based on the irresponsible actions of the US FDA.
Totally agree. I mean, look, I will confess right now to my crimes. We tried to help people smuggle ivermectin into hospitals when they wouldn't let it in. I had friends and family that were like, oh, so-and-so's in the hospital with COVID, and they won't let us bring any other drugs. They won't give them anything. They want to hook them up to a ventilator. I'm like, no, no, no. Secretly get them ivermectin and hydroxy. They'll be fine. And I was like, I'll bring it to you. I'll sneak it into the hospital. It was ridiculous back then, and it really upsets me that Americans have such short-term memory loss. Can y'all remember what they said about you, what they said about people that were just trying to help you and your family members? Doc, how about the downgrade of COVID? Now just treat it like the common cold, no big deal, right?
The two things have made the virus such a mild infection now. One is natural immunity. People have had it over and over again, so progressively the natural immunity makes the next case even milder, and the strains are now sufficiently weak. We have very good early multi-drug treatment protocols. I've called for the vaccines to be removed from the market now in the U.S. Senate, the House, European Parliament, all over the world. Multiple calls now. The vaccines are making things much worse. They're extending the pandemic, weakening immunity. And it's those who take the vaccines are the ones who are getting COVID over and over again, as shown in the Cleveland Clinic study, Dan. So we need to finish this out, pull the vaccines off the market, treat remaining cases, and then there'll need to be a deep dive into the wrongdoing as we are starting to uncover in these stories as they evolve.
This is why we like you so much. You were talking about the vaccines and the problems it's caused. Guys, pull up that headline. The CDC released a 148-page study on myocarditis linked to the vaccine. And I want to show you this because I'm sure you saw this, Doc. So, folks, what you're looking at is 148 pages of redacted information. Every single freaking finding is redacted. That page is not blank because we messed up. That's on purpose. That's intentional. So, Doc, what do you make of the CDC saying, here's our study that I'm guaranteeing proves that the vax is causing myocarditis in thousands of people, maybe millions, and we've redacted every single damn page. What does that say to you?
Dan, I commented on this in the Arizona Senate on March 15th, 2024. Again, this is gross malfeasance. Remember, the CDC works for the U.S. public, and when they're requested to send a document, they need to send it. They have no right to redact all the scientific data. My conclusion is that this manuscript almost certainly shows serious myocarditis as a result of the vaccines. The CDC, because they're still pushing the vaccines, they don't want to show this to Americans. So now the CDC is intentionally deceiving the public on an emerging public health crisis that is myocarditis after the vaccines.
Exactly. And the last one, 'cause I know you got to run and actually take care of patients like a good doctor, unlike these jerks at the CDC and FDA. The FDA, though, admitting They believe they've found a link. COVID vaccines significantly elevate the risk of giving your toddlers a seizure. Parents, did you hear me? Do not have your children take this jab. This coming from the FDA admitting it, that kids, little toddlers, significant elevated risk of seizures. Final word to you, Doc.
Dan, remember, in children, the vaccines have never clinically indicated or medically necessary that kids get mild COVID. And when a vaccine causes a seizure, that is not a benign event. It's very serious. It can be linked to death, ultimately a progression to epilepsy. Febrile seizures have been related to later development of neuropsychiatric syndromes, including attention deficit disorder, Asperger's disease, and autism. Febrile seizures are to be avoided, and the vaccine should not be used in children.
There you go, folks. This is why we've been trusting this doctor on this program for 3 years. He tells it like it is. He's not bought and paid for by the government or Big Pharma. Dr. Peter McCullough, thank you, Doc. Appreciate you so much.
Thank you.